Live from KTV in Reno, you're watching 2 News at 4:30.
Many of these patients don't need an ambulance, nor do they need to be seen in the emergency room.
A new service helps REMSA staff get people the help they need without tying up vital resources. How it works tops 2 News at 4:30. Now, over the past year, REMSA has rolled out a new protocol called Alpha and Omega. I'm Ariana Bennett.
And I'm Kristen Remington. Thanks for keeping it here with us. As Chris Buckley explains, it's a way to prioritize those 911 calls at the emergency dispatch call center to get the patients the right level of care and quickly.
Hello, my name is Jeff. I'm a registered nurse at REMSA.
Registered nurses are now on the line at the REMSA call center, here to take the calls that aren't considered life-threatening.
So essentially, when somebody calls 911 and they may have an earache, a fever, a sprained ankle, we can take those patients, we go through an algorithm to make sure that they don't have something serious, chest pain, shortness of breath, and then we can transfer them over to our registered nurses, who then will ask them more questions and then recommend a level of care that's appropriate. Many of these patients don't need an ambulance, nor do they need to be seen in the emergency room.
REMSA responds to about 220 calls a day, and roughly 10% fall into this category. The goal is to help reduce some of the load on the 911 system. The center sees a 4% increase in calls every year.
You know, on average, it takes our ambulances about an hour from start a call to finish, and so that reintroduces those ambulances for those patients that are experiencing life-threatening emergencies.
It also helps take some of the pressure off local emergency rooms.
We're going to try to find out what services you need.
Responding an ambulance to everybody that calls that has a toothache or a fever or a sprained ankle is sometimes just not the most efficient way. But this is one way, and kind of one piece of that pie, where we can efficiently navigate patients to the right level of care safely.
REMSA is the only agency offering this service on a 24-hour basis in the state. Covering the story, Chris Buckley, 2 News.